Hello and welcome to my YouTube channel titled Operation Breathe. My name is Megan and I created this channel specifically to shed light on life with disability, more specifically interstitial lung disease. I have interstitial lung disease. It's a fibrotic and progressive disease that destroys your lung tissue from the outside in. I was not born with this disease. Mine is through environmental and toxic exposure while serving in Iraq. I'm one of a few people in my unit that have breathing difficulties. I'm the first one in my unit to be diagnosed with this, but I am not alone in this journey. There are countless other veterans who are also facing similar situations that I am with this disease. Again, the reason I created the channel is to kind of push things forward and shed light on the situation, as well as show that you can live a normative life even in the face of having a progressive disease. This video specifically is going to discuss that, as well as other questions that have been asked through comments from subscribers and viewers who have left comments in the last 8 months that I've been doing YouTube. So here is the big list of questions and answers to which I will move forward from. One of the biggest questions that I get asked a lot is, why am I on oxygen? The most simplistic answer to that is, I can't absorb the same amount of oxygen in my lungs that a normal person can. So when I do an exercise test, which is walking around with a pulse oximeter, which measures your oxygen level in your blood on your finger, I drop considerably. And by considerably, I went from a normative level to 84 in less than 30 seconds, which is not good. Even to this day, I still drop within the first minute to the low 90s without oxygen on. The other reason I have it is when I first started getting sick, I had a sleep study done and they found out that I drop in oxygen concentration at night as well, which is referred to as sleep hypoxia, which means low levels of oxygen while you're sleeping. So I've been on oxygen for about 2 years now, and full-time since May of 2016. I also have what's called exercise-induced hypoxia, which means when I'm active walking around, my oxygen levels drop. That's why I'm wearing oxygen right now, because they're dropping. But it's okay, because that's this life, and I'm used to it. But we move forward from there. How long have I been on oxygen? I've been on oxygen since January of 2016 for nighttime use only, and full-time since May 25th of 2016 because I drop in exercise-induced hypoxia. Another question I've been asked is, what are my O2 levels without O2? That depends on the activity. If I'm sitting around doing nothing, like just relaxing at home in my climate-controlled house with no strenuous things going on, I can be off of my oxygen at about 94 is what my level is for about an hour, and then I'll start to drop. And if I get up and start moving around, it drops even faster, and then I need oxygen. So I can go about an hour a day without using this, maybe 2 depending, but I do drop considerably when I'm not on it, and especially since I'm used to having that supplemental oxygen now. My lungs don't work as hard to process the oxygen, but they still suck at being lungs. On top of that, with exertion and activity, without oxygen on, I will drop to the low 80s, high 70s in oxygen saturation. When did my symptoms first start? That is an excellent question. My symptoms first started back in 2014. I was training for another triathlon. I was running 8 miles a day. I was biking 20 to 30 miles a day with no problem. And I was fit. I was really getting ready to go and have just an awesome triathlon. I went for a run one day. The next day I couldn't breathe. So I went to the hospital because with my old job I used to fly a lot, and one of the big concerns is pulmonary emboli, which are blood clots that go from your legs to your heart and to your lungs. And I'm like, that was a concern. They couldn't find that, so that was a plus. But on the first CAT scan they did, I had what was called central bronchial nodules everywhere, about 1 millimeter to 3 millimeters in size, which is about the standard size of a diamond stud earring. I continued to get testing for almost 2 years, and nobody could figure it out while my lungs were still continuing to decline. It wasn't until September of 2015 that I had a lung biopsy done and showed that I have what is called obliterative bronchiolitis. One of the trade terms for it is constrictive bronchiolitis or bronchiolitis obliterans. Those 3 names are the exact same disease. There are different variations of what I have and different ways it reacts to the lungs, but the outcome is still the same. It's still progressive and it still ends in death. Yes, it is a terminal disease. My official date of diagnosis was Christmas Day of 2015. That's when everybody finally said, yes, this is exactly what you have. My pathology results came all the way up here to Washington, D.C. with me. They were tested several times, they were sent to other labs, and all of the labs agree. And even the hospital up here agrees with the diagnosis of obliterative bronchiolitis, which sucks, but it's life. So, how was I diagnosed is an excellent question. The Cliff Notes version of it is, eventually, at the end of getting diagnosed, and at the end of everyone trying to do their thing, I had a high-resolution CAT scan done that showed ground glass opacities in my lungs, as well as central bronchial nodules and some other not so nice things. Days after that, I had a surgical lung biopsy, which is, they come in on your side here, they cut you open here and in the back, and they stick rods basically into your chest, collapse your lung, take several chunks of your lung, and then send it off to biopsy, or send it off to pathology. So basically, that was what diagnosed me definitively, because there is what's called submucosal fibrosis, as well as evidence of constrictive and inflammatory obliterative bronchiolitis. Another way that I was diagnosed was also through pulmonary functions testing. A PFT is a special test that you sit in a little booth and you blow into a mouthpiece that's called spirometry, and there are several other tests in that test that measure your total lung function. Right now my total lung function is about 47% of normal. For a 29-year-old, that's pretty good. Sarcasm there. It's not that good at all. Tests that were done were neurological, psychological, and cardiac tests. Reason for neuro and psych is one of the tests that I did with PFT showed that I had muscle weakness, so they examined my muscles to ensure they were not the cause of my difficulty breathing. Psychological evaluations, because maybe it is in your head. It wasn't. I definitely checked, but we have to rule that out. Cardio, my heart looked great, but they wanted to do what was called a diastolic heart failure test, where they go into your neck and inflate a balloon in your heart and measure the diastolic pressure of your heart. And I said no thank you, because I knew it was lungs, not my heart. Did I have a lung biopsy? Yes, I did. And that was probably the most excruciating pain I have ever felt in my life. So bad that I don't remember it. And it's not because of the biopsy, it's because of what happened after the biopsy. I thought it'd be a good idea to kind of elbow my chest tube and rip the chest tube out, which caused my lung to collapse again and caused me to have extreme difficulty breathing for 4 minutes while the surgical residents come running in and reinserted the chest tube. Yeah, that sucked, but yes, I did have a lung biopsy and it shows obliterative bronchiolitis. What is my prognosis? That is a difficult question to answer because of how progressive and the nature of my disease is. It can progress really fast or it can progress really slow. Some people will stay the same for years, and you can go 10, 20 years and never get worse. And other people, you get worse every day. And one of the caveats to this is my doctor said that one day I could be perfectly fine and the next I'll be 50 times worse, because that's just how the disease works. On average, it's a 3 to 5 year time frame from point of diagnosis to point of no return. Again, that is an average, it's not a definitive, and every person is different with this disease. So far, I've been officially diagnosed for almost 2 years. I have declined considerably in that time frame, but the last couple of months I've plateaued at where I'm at. So that is a good plus, and it leads into the next question of, am I a candidate for lung transplant? The answer to that is yes and no. I will explain. Yes, I'm a candidate for lung transplant because I'm healthy, I've lived a pretty healthy lifestyle, and I'm young. And once my disease gets past a certain point, yes, new lungs will be beneficial. At this current moment in time right now, I am not a candidate for lung transplant because I am not sick enough. So I'm too healthy, but I'm also really sick. So it's that fine line and semblance between whether you are a candidate and you need it now, or you're a candidate but you can hold off a little bit. I'm fine with holding off a little bit because even though my lungs suck, they're still my lungs. Another question I've been asked is, what kind of medications am I on? I am on a lot of medications. My current list that I take on a regular basis are azithromycin, 250 milligrams 3 times a week. Azithromycin is an antibiotic used more as a prophylactic to help prevent lung infection with people who have lung disease. One of the downfalls of lung disease is you're susceptible to a lot of infection, especially when you're on azithromycin. I'm on Singulair, which is an allergy drug, as well as an asthma drug used to help open my airways. I'm on albuterol nebulizers and albuterol inhalers, which help open me up, but they only work to a certain point. My body doesn't react very well to steroid medication, so initially it works, but once I use it too much, it just stops working. So I have to be off of it for at least a couple weeks and then use it. So I kind of vary the amount of albuterol that I use. I take Atrovent inhaler, which is another drug that helps open your airways, and it blocks the receptors that cause constriction, which is the clamping down of your bronchioles in your lungs. I'm also on ipratropium nebulizer, which is Atrovent through a nebulized cup, which you breathe in. It basically turns liquid into a vapor and you breathe that vapor in. Kind of like the e-cigarettes, except not as bad for you. On Zyrtec, which is an allergy drug, I'm on oxygen 24/7. I take pain medicines, different kinds, both non-steroidal anti-inflammatory devices and drugs, as well as some other hardcore stuff that I only break out on special occasions. More along the lines of when the pleuritic lung pain I have gets super bad, I take that stuff. I'm also on muscle relaxers to help calm the muscles in my lungs down, as well as in my legs and chest and everywhere else, because it's a broad spectrum muscle relaxer. And steroids on and off. Are there any other medication options that are available for me to use? The answer is yes. My doctor and I have been discussing a drug called Celcept, which is an immunosuppressive drug, which means it lowers your immune system and helps prevent inflammation and the advance of my disease, because my disease follows an autoimmune track where it destroys itself. Yes, there is Celcept, and then we've also been talking about an experimental trial called IVIG. IVIG is intravenous immunoglobulin, which is a blood product which boosts your immune system. Currently, it's not used for people with this disease on a regular basis. However, the NIH, which is 40 minutes from my house, has been doing experimental trials on older adults with interstitial lung disease, and it's shown promising results in 6-month trials. Only downfall is after the 6 months are up, the submucosal fibrosis continues to progress, and so do ground glass opacities, which is what you see in a CAT scan when you have fibrosis in your lungs. So we're kind of not looking at that in terms of what I can and can't do with the medication, but it isn't off the table completely. Another thing that could help is pulmonary rehabilitation. Basically, my doctor said that it's a good idea to go to, but it's a complete and utter waste of money at my age because I know all of the exercises that need to be done anyway, and I can do it without having to spend thousands of dollars and going to the hospital to go work out for the day. So that is in and of itself one of the more challenging aspects of my disease as the progression continues. Another question I've been asked is, what is the most helpful of all of my medications? In times of emergent need, my nebulizers are the best because it opens me up at least enough to get some air moving. But my all-time favorite medication is my oxygen. This has afforded me the opportunity to not be utterly short of breath all day long, and it allows me to get out of the house and actually be able to go out and do things and enjoy life and kind of live in the moment, because again, this disease is progressive and we all know what that means. Another question I've been asked is, what degree am I working on? So I have several degrees already. I have degrees in psychology, both bachelor's and master's, and the degree I'm currently working on is my doctorate degree in clinical psychology with a focus on being a prescribing psychologist, which essentially is the best of both worlds. You're not necessarily a psychiatrist, but you're also a little bit more than just a regular psychologist. To me, I find the human mind fascinating, and I want to help people bridge the gap between mental illness and normal life. Mental health is extremely important, and I think it's more important than physical health some days, but it's just as important as anything else. And I want to be the forefront of mental health and getting it out of the dark ages and bringing it to normal society and not having it be so stigmatic. Will I do pulmonary rehab? The answer to that is yes, I will do pulmonary rehab, but I will focus more on an individual basis at my local gym or here in my house to help strengthen my lungs. Tying into that is, what is the best exercise that I've done for my lungs? To me, I find yoga is the easiest and most helpful with focusing on your breathing while still getting exercise and still strengthening your lungs. I do walk around a lot, which helps, but walking with lung disease and being on oxygen, even though it's really good for you, at the same time you can wind yourself out really bad. And with me, when I do wind myself out beyond a certain point, it's a very long couple of hours to get back to a normal level. So I try not to do that too often, but I do yoga semi-regularly, which seems to help the best. Interesting question that I've been asked is my disease actually to the fibrotic point, or is it still on a cellular level? The answer to that question is both. When I had my lung biopsy done, we saw the fibrosis, we saw the inflammation. I didn't see it, but the surgeon saw the brown fluid oozing out of my lungs that he's never seen before and went, "What is this?" Which turned out to be several types of metal and sand stuck in my lungs, which was pretty cool. And also on biopsy, we see that it's both cellular and fibrotic, which means it's inflammation and there's scar tissue. So it's both. Once you get to the scarring aspect of it, you can't reverse that. It only gets worse from there. But we can try and slow it down with the medications discussed earlier. What kinds of treatment do I receive while I'm in the hospital? I receive the normal lung pulmonary type treatments, such as nebulizers every 4 hours, and those nebulizers are duonebs, which is both albuterol and ipratropium together. I get those every 4 hours. I get steroids every 12. I get my normal medications every day. I get pain medicine every 4 hours, sometimes every 2, depending. And I also get antibiotics. Most of the time I get hospitalized, it's because of a weird type of liganded pneumonia. And because I'm on oral antibiotics all the time, regularly, we have to step the game up. So usually I get IV antibiotics or IV drugs that are stronger to help open me up. I also do a lot of exercises when I'm in the hospital. They'll walk me around the floor just to help keep my pulmonary and physical strength up. So that way I'm not stuck in a hospital for 7 days or longer, which normally it's about 6 to 7 days a stay, and being completely and utterly weak when I leave. Why do I have a port? The reason I have a port is my veins suck at being veins these days. When I was healthier, my veins were awesome. You could throw a 14 gauge needle into it like a lawn dart and stick it and have no problem. Ever since getting sick and being hospitalized all the time, my veins have developed valves in the areas where they go in with an IV catheter, and they actually bend and twist the IV catheter in my arm. So when they go in, an IV catheter is straight. When mine comes out, it's U-bend like that, and usually fails within the first couple of days. Sometimes within the first couple of hours, depending on the angle in which they went in. The port is 1 or 2 needle sticks at best. The needle can stay in for 7 days. They can draw blood from the port as well as push medicines through the port, and it's a guaranteed access line. Also, for in the future, if we do go the route of IVIG, when I get those infusions, it's better to get it through the port than through your veins. Other health problems that I have. So, I'm hard of hearing. That is courtesy of Iraq. I wear hearing aids bilaterally all day. The cool part is they're new and they're rechargeable, so it's nice to be able to hear again. I also have pancreatic insufficiency, in English. My pancreas doesn't want to work right, so I usually have chronic hyper amylase and lipase levels in my blood, which means it's not getting into my digestive system. And lately, with all the steroids I've been on, my sugar has been really jacked up, so my sugar has been running really high. I also have a lot of GI problems that constitute some of the other medications that I take, and that sucks, but that is also a downfall of my particular version of my lung disease. Yeah, that's pretty much my Q&A for today. I thank you all for watching and subscribing. I hope that this video has been educational and helpful. If you have other questions you'd like to ask, or you'd like to leave a comment, please leave one down below. And if you haven't subscribed yet already, hit the subscribe button just below you and hit the little bell, and it'll tell you when I post videos. I do videos every day showing what my life is like and what life is like with lung disease. And I appreciate everybody who comes and joins me on this journey. I'm going to end this video like I do every other video by saying, as always, have a great day, and I will see you guys tomorrow.